Today we explore the conversations around the problems affecting quality healthcare in Africa on our platform CoalSearch and Progress Uncluttered. CoalSearch is a social media platform dedicated to inspire conversations around sustainability, policy making, and social change, while Progress Uncluttered is a media outlet through which we engage in these conversations. So the problems affecting the quality healthcare in Africa are multifaceted. There are a couple of issues like inadequate access to healthcare, shortages of health workers, weak infrastructures and resources, high cost of healthcare, and a high burden of infectious diseases. But let's take them one by one. So the first of all is the inadequate access to healthcare. Many people in Africa, particularly in those in rural areas, have limited or no access to healthcare facilities and services, which can lead to delayed diagnosis and treatment, which worsen health outcomes. We should also know that there are a lot of people, a large part of the population in Africa still live in rural areas or even in cities that have rural areas type of designs, which have inadequate access to healthcare. The second thing is the shortages of health workers. There have been severe shortages of healthcare workers in Africa, including doctors, nurses, and midwives. This shortage is due to a number of factors, including poverty, lack of training opportunities, and brain drain. The brain drain is particularly much of a problem today because a lot of healthcare workers are finding greener pastures in Western economies and live in African economies, which is affecting the quality of healthcare in Africa. The third part to mention is the weak infrastructure and resources. Healthcare facilities in Africa often lack basic infrastructures and resources, such as electricity and water, which are the main components of any infrastructure, and also sanitation. This can make it difficult to provide quality healthcare and also could lead to the spread of infectious diseases. Another point to mention on weak infrastructures is the fact that many hospitals are not really equipped with the right proper infrastructure and resources to be able to take in a lot of patients and give quality healthcare to a lot of patients. The fourth thing to mention is the high cost of healthcare. The cost of healthcare in Africa can prohibit many people, especially those living in poverty. This can lead to delaying of foregoing healthcare needs. The thing about this problem is that it's not that the hospitals itself are very expensive. It's that there are a lot of people that are living in poverty and really can't afford basic healthcare. The fifth thing to mention is the high burden of infectious diseases. Africa is home to a high burden of infectious diseases such as HIV and AIDS, malaria, and tuberculosis, among many others. These diseases can have a devastating impact on individuals, families, and communities. The sixth thing to mention is the lack of access of medicine and essential supplies. Many people in Africa lack access to essential medicine and supplies such as antibiotics, vaccines, and contraceptives. This can lead to preventable death and illnesses. So in total, these are some of the major problems that we've discussed on our platform CoalSearch and Progress Uncluttered. You can actually go on progressuncluttered.com or CoalSearch.com to check up these conversations and engage with them. Thank you and have a nice day. Thanks for watching. Don't forget to subscribe, like, and share with your friends. See you next time.